Periodontal Case History Recording, Part 3, Diagnosis of Gingival and Periodontal Diseases. As an undergraduate student, there are few periodontal diagnoses that are a must-know. The most frequent diagnoses in periodontology are gingivitis and periodontitis. This video will guide you through diagnosis of the same. Hope you remember this table. This records the gingival examination. This table will give an idea about the sites that are healthy and those that are diseased. And this table records the periodontal parameters such as probing pocket depth, clinical attachment loss, etc. This table will distinguish between teeth with gingivitis and those that are periodontally involved. Let's now look at how to diagnose gingival and periodontal diseases. This is done in a sequential order, almost like an algorithm. The two main entities are gingivitis and periodontitis. So, first determine whether the given case is gingivitis or periodontitis. If the case is diagnosed as having periodontitis, the next step is to determine whether it is chronic periodontitis or aggressive periodontitis. Once that is established, the final step is to see whether it is localized or generalized. Let's see step 1. How to differentiate between gingivitis and periodontitis. In case the teeth involved have periodontal pocket, clinical attachment loss or mobility, then the teeth are supposed to be periodontally involved. In absence of these findings, when just mere presence of inflammation, which is evident from change in color, contour, bleeding on probing, etc. are seen, it is indicative of gingivitis. Look at this example, case 1. There are no pockets, no recession or no mobility. But all signs of inflammation are evident with the presence of local factor, namely the plaque. Hence, this case is diagnosed as generalized plaque-induced gingivitis. In case 2, mere visual examination reveals this is a case of periodontitis because of the presence of recession. So, the next step is to differentiate whether it is chronic or aggressive. 4 main factors are to be considered in differentiating chronic and aggressive periodontitis. They are the age, systemic status of the individual, local factors, and the family history. Chronic will be more frequent in older individuals, but it can also occur in younger individuals and children, whereas aggressive occurs in young adults, probably circumpubertal in age. Local factors will be abundant in chronic, whereas in aggressive only minimal local factors will be present. Despite very minimal local factors and clinical inflammation, the amount of destruction will be more. This is an important differentiating factor next to age. Systemic factors might influence chronic periodontitis, whereas aggressive periodontitis will occur only in systemically healthy individual. Finally, aggressive periodontitis will always present with family history. The parents or siblings will present with similar findings. Though chronic can have familial history, this is not a consistent or constant finding. Now coming back to the example. In history, the patient is 55-year-old with presence of abundant deposits of plaque and calculus, and the patient is diabetic. This case hence is classified as chronic periodontitis. Now, the third step is to classify whether it is localized or generalized. In chronic periodontitis, when less than 30% of the sites is involved, it is localized, and when more than 30% of the sites are involved, it is generalized. To simplify, if less than 8 teeth are periodontally involved, it is localized chronic periodontitis, and when 8 or more teeth are involved, it is called as generalized chronic periodontitis. Back to the case, looking at the periodontal charting and marking. More than 8 teeth have pockets and attachment loss. That is, they exhibit features of periodontitis. Hence, this case is finally diagnosed as generalized chronic periodontitis. Moving on to case 3. A 25-year-old patient reports with complaint of sensitivity in lower front teeth. Visual examination reveals that there is recession in 3.2, 3.1 and 4.1. So, this is clear case of periodontitis. Now, looking closely, local factors are abundant in involved sites. Hence, this is chronic. And since only 3 teeth are involved, that is localized. Now, what about other sites? There is evident inflammation in rest of the teeth. Hence, those teeth have gingivitis. Hence, your diagnosis is generalized plaque-induced gingivitis with localized periodontitis in relation to 3.2, 3.1 and 4.1. Moving on to case 4. A 16-year-old systemically healthy patient reports with mobility in lower front teeth. The first step is to differentiate between gingivitis and periodontitis. Clinical examination reveals recession in lower teeth, so this is a clear case of periodontitis. Next step is to determine whether it is chronic or aggressive. Considering the young age, no systemic involvement and presence of very minimal local factors, this case is diagnosed as aggressive periodontitis. The final step is to determine whether it is localized or generalized. The criteria for differentiating extent of involvement in aggressive periodontitis is different. When the disease is localized to first molars and incisors with interproximal attachment loss and at least 2 permanent teeth, out of which, one should be a first molar, then it is localized. In case of generalized interproximal attachment loss and at least 3 permanent teeth other than the first molars and incisors, then it is generalized. To keep it simple, if only incisors and molars are involved, it is localized. In addition to incisors and molars, if involvement of premolars and canines are evident, then it is generalized. Looking at the periodontal chart of the case we were seeing, it is evident that only incisors and molars have attachment loss. So this case is diagnosed as localized aggressive periodontitis. This is a case of 26-year-old systemically healthy patient presenting with mobility in all teeth. On clinical examination, recession is evident in all teeth. Hence, this is a case of periodontitis. Again, considering the young age, systemic condition and presence of very minimal local factors, this case is diagnosed as aggressive periodontitis. Periodontal charting reveals attachment loss in all the teeth, inclusive of canines and premolars. Hence, the final diagnosis is generalized aggressive periodontitis. Let's take a quick look at 2 more examples. This is an 18-year-old complaining of receding gums in lower front teeth. Hence, recession is present. So, this case is periodontitis. The patient is young, no systemic involvement is seen, and there is no local factors. Hence, you will be tempted to diagnose this case as aggressive, maybe even localized aggressive periodontitis. Now, pay attention. By definition, localized aggressive periodontitis should involve attachment loss in first molar. First molar in this case is not periodontally involved. So, this is a case of chronic periodontitis. Since only one tooth is involved, this is localized chronic periodontitis in relation to 3-1. Finally, this is the presentation of a 23-year-old who is diabetic for the past 7 years, complaining of generalized mobility and recession. On clinical examination, very minimal local factors and inflammation is present, and periodontal examination reveals attachment loss in all of the teeth. Considering the age, clinical presentation, you might misdiagnose this case as generalized aggressive periodontitis. In history, the patient is found to be diabetic for the past 7 years, which means the patient is not systemically healthy. Hence, your diagnosis should be generalized chronic periodontitis. So, the following factors should be meticulously considered in diagnosis of gingival and periodontal diseases: the gingival and periodontal finding recordings, the history, namely the age and systemic status of the patient, and finally the amount of local factors. Correlating all these recordings will lead to correct diagnosis of the case. To summarize, whenever a case is given for diagnosis, after thorough history and proper recording of findings, first identify whether it is gingivitis and periodontitis. In the second step, determine whether it is chronic or aggressive. Thirdly, see whether the involvement is localized or generalized. Thank you.